Web City Girls.
Hello, this is Lynn Ponder from Web City Girls, and you might know my sister Linda Ponder, also known as Ponderella on Twitter, and we've been talking about changes in our body. So Linda connected me with Amy Jaramillo.
Hi, everybody.
She has a last name in Spanish, but she really doesn't speak Spanish.
I speak some Spanish. It's just not good quality Spanish.
Oh, okay. So let's do this in English then. So Amy Jaramillo is the patient director at Juventus Med Spa. She has more than 15 years of experience in the health field, and she's also a graduate from Florida State University.
Go Tallahassee.
Woo! And today I want to talk about hormonal changes because that is one of your specialties. And at what age should we take notice of hormonal changes in our body?
I'll tell you, Lynn, hormonal changes can occur at any time. Young, old, oftentimes is a life event. Sometimes it's after a pregnancy for women or menopause. For men, oftentimes it's after a very stressful event or with older age. Oftentimes younger girls coming off of birth control. So it's a pretty wide variety as far as ages.
So I like the fact that she mentioned men. Maybe that's why they are a little bit neurotic sometimes.
Maybe.
And what are the symptoms? I guess that, to define if you have hormonal changes in your body, you could be stressed, you can have memory loss. There's different symptoms that come up, right?
Yeah. Most people know something's going on because they notice a change. So either they used to have energy during the day and now they start feeling fatigue. They used to sleep well at night and now they're having difficulty either falling asleep or staying asleep. Let me think. Focus and concentration, you touched on that. That's a really big one where you just aren't as sharp as you used to be. Hot flashes, that's something that a lot of people know about and think about when it comes to hormones. When I met Linda, it was because she came in for weight gain. It is not uncommon to have not just weight gain, but find that it's really tough to get weight off, especially when that wasn't the case before.
So the procedure is to go get tested, right, to see what exactly is happening in our body?
That's right. Numbers, right? It all comes down to what the hormones look like and how balanced they are to each other. The gold standard is always blood tests. You can get a blood test almost anywhere at a doctor's office. The advantage, it's easy to find. The disadvantage, blood is going to tell you what your body can make, but not necessarily what you're using. And that becomes a challenge if you've already had some symptoms, you've gone to the doctor's office, and you say, hey, listen, I feel different, something's changing. You get your labs back, and they say everything looks normal. The limitation with blood is, again, it can tell you what you're making, but not what you're actually using. So I like, in addition, to use saliva and urine. Saliva is going to tell you what's active. So not just how much you made, but how much you can use. And urine is going to tell us, after you've used everything up, what's left. Do you have too much?
I love how she's explaining, this 101 in detail. I'm learning a lot here. So I have another question. How long would the therapy take, if I have to, like Linda, who's probably going to go into therapy, hormonal therapy, and is it safe?
All right, good questions, right? First of all, just because you have symptoms, just because you're worked up for hormones, doesn't mean you need hormone therapy, right? The reason to go get it checked out is because if you do have hormones and they're not regulating correctly, it makes bodies older faster. It makes bodies sicker sooner. So the key is to know if your hormones are too high or too low, it puts you at risk. So at that point, you'll probably have the discussion about potentially starting a therapy of hormones, or if you're on a hormone therapy, maybe adjusting it. Your question was, is it safe?
Yes.
Yeah, okay. So hormones are not good or bad for you. Instead, it's all about the balance. If you take hormones and you don't need them, they're not good for you. If your body needs hormones and it can't get access to it, that's equally not as good for you. So the key is to know your numbers, make sure that you're thorough, not just blood, and then if you need treatment, go find somebody that you feel comfortable with to make sure you get the treatment that you need.
Great advice, and I would go to Amy. She's the expert.
Thanks.
Of course. So thank you so much for educating me and the audience. We're going to check you out on your website, and we're going to come back and do another interview about weight loss, because Linda's also going to be on that treatment, and I want to find out how does that work. Thank you so much.
Thank you. I'm looking forward to the next one. Bye, guys.
Bye. Thank you. Ciao.
Whip City Girls.